I feel like I'm among friends and peers. So thanks for having me. My current job, current full-time job is as a consultant and trainer for the Center for Innovative Practices, which, as Dr. Getz pointed out, is one of OMAS's, Ohio Mental Health and Addiction Services. We're one of their centers of excellence. And I also have a private side business called Life Adventures for All. And that is where I continue to do my adventure therapy work and training because I find it so relevant for many of the traumatized youth and families that we work with. So I'm going to fly through this PowerPoint so you guys can get to your case, but I'm going to try to give you a little idea about what is adventure therapy and why is it all that. So in adventure therapy, we intentionally use adventure or experiential activities to get people to learn skills, to get people to have a different perspective on some of their issues and problems, to get people to actively engage in changing how they approach things or what they do. And to that end, I have a hard time not actually doing a little adventure therapy with you while I talk. So what I'd like for everybody to do is fold your hands. However you fold your hands, just fold your hands. Don't worry, we're not going to pray. We are just thinking about how we fold our hands. And what I'd like you to do is look down at your hands and tell me, do you have your left thumb or your right thumb on top?
Right.
Left.
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 Left. Left.
Left.
Bunches of lefties. How many people have right, since that seems to be the 1, 2, 3. Okay, so 4. So we can see that it's a little bit of a mix. Now what I'd like you to do, shake it off. Fold your hands again, only this time put the other thumb on top.
Feels weird.
Leave yourself unmuted for a moment. And how are you responding and reacting to that simple direction? Barb, what's up?
Strange.
Feels strange?
Feels strange.
Awkward?
Yeah.
Little uncomfortable?
Uh-huh.
Mm-hmm. Hold it there. Just stay there for a minute. Let me suggest to you that this is what we ask our clients and families to do all the time. Do something different. Do something that's a little uncomfortable.
Well,
It's not natural for you to do it this way. And we ask people to get uncomfortable all the time. And then we would just want to keep moving on. Okay, glad you can do that in the uncomfortable way that I've just taught you to do. Can you just keep doing that indefinitely? What if you shake it off? And I suggest to you, go ahead and fold your hands again. Did you do it the new way or the old way?
old.
3 or 4 years of therapy, I'll be ready to switch.
Well, I hope it doesn't take quite that long, Doug, but this, I think, is a good example of how we can draw attention to things through experience as opposed to just talking about it. So let me go back to my PowerPoint for a second and zip you through a little bit more about what adventure therapy is and can do. Now, for the most part, adventure therapy is done live and in person. And I had to come up with a tiny little activity that I thought we could do virtually. And I think you could feel some of the feeling things that we would want clients to think about and feel. Adventure therapy is also typically, not always, but typically a group-based intervention. I just got done filming a resource video on adventure therapy for parents, though. And you can do adventure therapy one-on-one or in families. What is family if not a small group? And so typically it's a group-based intervention because you want people to discuss and have feedback about what's going on. But most frequently is a multi-sensory intervention. And so we don't just talk about things, we do things. And it is a legitimate clinical treatment within the behavioral health field. Oh, sorry, interactive. As a matter of fact, I've just been part of a team who published a textbook on adventure group psychotherapy because it is becoming more popular, and we wanted people to know why it works and what's going on with it. I want to give you my bias, though, before I go any further. I focus on children, youth, and families. I am not necessarily an adult provider, but that has always been my focus, children, youth, and families. And I have nearly for my entire career had a trauma lens. Even before it got uber popular with the ACE study, the recognition that what we're really working on is trauma. People come to us, come to behavioral health care for all sorts of symptoms. But until we understood more about trauma, we didn't realize the underlying causes of those symptoms. If trauma is the problem, and it almost always is, resiliency is going to be the solution. And we want to think about how we can keep that in mind. Speaking of mind, mindfulness ought to be a part of most treatment interventions these days. It isn't always, but it ought to be. If we can't reflect and quiet our minds a little bit enough to be present, then we're missing part of what we can impact and do. I also am a firm believer that poverty is traumatic stress. It functions as a trauma. And as a matter of fact, it functions as a lightning rod for additional trauma. And that frameworks are better than scripts. While I love the data and the information that we get out of evidence-based programs, I'm not a believer that only evidence programs are solutions. I think we can pull the relevant components and ideas from evidence-based programs, but we have to be more flexible and lighter on our feet than just saying, I'm going to do this evidence-based thing for you. And finally, I'm a true believer about adventure therapy. It's not just a good option. I think that experiential interventions are required for real healing. And we got to get people on board with doing things, not just talking about things. The foundations of adventure therapy come from experiential education. And it's very similar. If it's good to get students up and doing things, isn't it good to get our clients up and doing things? Adventure group therapy, referred to as adventure therapy, has a variety of roots that it evolves from, but truly experiential education is where we draw a lot of our support and background for what we do. Learning is natural. Curiosity is natural. Wanting to try things and being excited about novelty, also very natural. And it is through active engagement in meaningful experiences and then reflecting upon those things that learning and progress can be made. A lot of this comes out of this experiential learning cycle that was Kolb in 1984, and I'm not going to spend a lot of time here. Let me just zip through it for you. And I make sure that we are fully informed. Anybody that I train or work with in adventure therapy understands, of course, the ACE study and all the problems therein. And again, I'm sorry, this is a longer slide set than I thought. I had deleted some of these. So we're going to get rid of them for you. And the way that I help to make adventure therapy as trauma informed as possible was to do a big review of all the trauma informed programs and things for youth and families. And 10 years ago, there were only a couple hundred of those things. Now there are a lot more. But one of the best programs I found to link trauma and resilience is the ARC model. The ARC model focuses on attachment, regulation, and competencies. And they have very specific building blocks to help people understand that. And as a matter of fact, Blaustein and Kinneberg have just released their second edition of that book, which I find terribly relevant and targeted to the families and youth that we work with. So if you're interested in more trauma-informed care interventions and background, this is a great book for that. But what it did for me was help me understand why adventure therapy is so effective. And it's because we hit all these competencies, all these components that they find important in trauma-informed work. And that includes the relationship they have with the provider and inside their groups. They can work on attachment with safety and built-in relationships with group members and with regulation. Of course, the fastest way to regulate somebody, even somebody who's emotionally dysregulated, the fastest way to regulate them is to physically get them moving and get their bodies to do some regulation. And adventure therapy is multisensorial and very interactive. So I'm not saying to kids who are hyperactive and stressed and anxious, sit still, just listen to me. Instead, we're getting up and moving nearly all the time. And during those movements, we are building skills and rehearsing things that we think are important for them to have under their belt. As you all know, kids are missing tons of skills because of developmental gaps that occur when they are under traumatic stress or being actively traumatized. And so we've got to figure out how to go back and help them identify first and then build those skills. I'm going to skip the resiliency. I think you guys understand resiliency and go to how does adventure therapy activate resilience in their with their clients. When I looked at all of the resiliency data, it fell into 4 big categories for me. And these are your categories: control, connection, competency, and contribution. And then these sidebars for each of these quadrants, if you will, talk about how adventure therapy directly impacts each one of these. So for instance, in the quadrant of control or the need to feel safe, we provide something called challenge by choice, which means I should have said to you all, please join me in folding your hands together if you choose to do so, because everything is optional. And by doing that, we're giving our clients choice and voice in how they participate with us. Okay, so we ask you to challenge yourself to as much as you can to get the most benefit out of it. But if you'd rather sit back and watch it happen first because your anxiety level is at that place, then that's fine. We'll let you watch first and join the next round, that sort of thing. There's some consistency across the programming in how it's laid out and the curriculum that we use. All of that helps the person feel like they are personally have some agency, some control in what's going on. I assume that you're also all very familiar with the fact that having safe, stable, nurturing relationships is the #1 marker for success and resiliency as you go through life. We used to think that it was how many traumas you had that were going to determine that, but it's really not. It's how many traumas have you had balanced with how much resiliency do you have, and the #1 resiliency you need is connection with safe, stable, nurturing adults. So we model being those safe and stable adults. And I use the word charismatic here because it comes from Robert Brooks' work. And it doesn't mean you have to sing and dance. It just means you have to be present and actually care about them and let them know that you're not like a blank slate. You're not a clinical prim and proper. You are in there with them. You're in there doing the activities, playing the games. Adventure therapy provides a social peer group for them, and fun cannot be overrated. Fun as a part of treatment ensures engagement, ensures motivation, ensures that they're going to connect with you. And so fun is not just a byproduct of adventure therapy, it's an intentional component. Competencies, I think we've all been good at skill building over the years, but a couple of things I want to point out that sometimes get overlooked. Problem solving is a #1 missing skill in traumatized people because they are so reactive to things. They don't take the time to do problem solving. And so that is a skill that must be taught and rehearsed with regularity with people who have significant trauma. And I'm so tired of people telling young children to go get self-regulated. We don't self-regulate, we co-regulate. We regulate. If I'm upset about something, I'm calling my friend and saying, oh my gosh, you never believe what happened. And if I don't get that answer and support that I want from that friend, I'm just looking for the next friend. It doesn't mean that I'm just going to go self-regulate. And I think that self-regulation is overrated and co-regulation is not understood well enough. And so that's something we stress in our programming. And then finally, I also think we don't give our clients sometimes an opportunity to be full humans and make contributions. We expect them to be the recipients of services. We expect them to need things. We don't think about what do they have to offer. And when we help other people, it's so good for us in terms of a shot of dopamine because we feel like we've made a positive contribution, and it takes us out of our self-ruminations. Same thing's true with the clients. Give them a chance to do things to help each other, to help the greater good, the bigger world, and we need to look for how to expand those opportunities. It should be part of treatment, not something that they can do when they're done with treatment. Adventure therapy is holistic. We deal with the whole person. We try to give them a sense of agency. We have shared experiences with them, and that increases their ability to be relational and feel like they belong. Skills and competencies and constantly building those is how we stay resiliency oriented, and the multidimensional feel of adventure therapy just sort of wraps up that holistic idea of how we work with clients. This is a heuristic of the adventure therapy model. It has multiple entry points. The A represents affect or feelings, the B, behavior and reactions, the C, cognition or thoughts, and it is all grounded around a relationship both with your provider, your facilitator, your therapist, and of course the other people in the group. The nice thing about this is that no matter which way you enter the topic or the theme, it impacts the whole, right? And so let me give you a little example, and then I think I'm probably going to be out of time, but somebody will have to interrupt me here in a minute. Here's an example. If I'm working on, let's say anger management, because we never have to deal with that, right? But if I'm working on anger management with some people, I can go in it from the affect or feelings part of it by doing an activity that I call anger thermometer, where we brainstorm all the words about emotions and put them in a hierarchical order. So rage is higher than irritation, right? And we put those in order on some construction paper, and we create a red ribbon so that they can slide that ribbon up and down the slots of that construction paper to indicate how do they feel when different things happen. Then we brainstorm some scenarios, like how would you feel if somebody stole your bike? Oh, that would be rage. How do you feel if your little sibling spills something on your homework? Well, that's irritating, but I don't care as much about homework as I do my bike. And they start to understand these emotions and how they have different levels, right? So that's going in from the emotional side of it. Behaviorally, we act certain ways when we're angry. And one of my favorite activities with that is I pick up a used suit at the local Goodwill or Salvation Army, a very large suit, and I call it the anger suit. And they take turns putting it on, and they let their body be angry. And they show me, how does anger come out for you? And what is the behavior like? And what do you want to do when you're feeling the anger suit? And then the other nice part about that activity is taking the suit off and talking about how do you let go of that anger, and how do you let your body not have those anger behaviors. And then finally, just to wrap this up, you could also go in it from the cognitive side, where we're thinking about anger and thinking about what to do about anger. And I have a bunch of little characters, little animals. They're squishy, like a stress ball. But they're all different, about 10 different animals, and I place them around the room, and everybody travels around from animal to animal, and they write on the paper next to that animal, how do you think this animal responds in anger? And, you know, I have a bull and I have an owl and I have a chicken and I have a turtle and I have a snake and I have a, and so they, and whether it's from literature and kids' stories, or it's from actual experience with the animals, you'd be surprised at how diverse these animals' anger responses can be. But then we start to go a little deeper into it and talk about what kind of, which animal are your parents most like when they're angry? Which animal would you prefer that your parent was like when they were angry? And which animal do you think you are like, and which would you rather be like? And so you can see how we get into all the relational dynamics. And these are all, you know, a dozen different ways to approach the concept of anger and anger management. And when you have a lot of different ways that you can deal with it and look at it, you are really, the neurobiology starts to make a difference, because instead of just one attempt at dealing with how to handle anger, we're coming at it from 3, 4, 5 different ways. And that strengthens the depth and the information they have around that. And it strengthens the notion that they have a chance to respond differently in the future by doing a lot of repetition. And I think the last slide I'll leave you with is this one, sort of comparing and contrasting using adventure therapy versus talk therapy. In talk therapy, of course, you have to talk. You're discussing things, and in adventure therapy, it's experiential. We're doing things instead. And I don't know about you, but I have occasionally been stumped by the kid who refuses to speak. Not because they're mute, not because that's their diagnosis, but they're irritated or they just don't want to talk. And that doesn't have to hang you up in adventure therapy. You can still do things with them, even if they're not as talkative with you. In talk therapy, we usually give skill building as homework. So we talked about this, go try it. I'll talk to you again next week. And in adventure therapy, it's in vivo skill rehearsal right there. And you're going to see how can they do it and why not, or how can we adapt or adjust. We coach for future responses in talk therapy, but we do point of performance coaching in adventure therapy, which is highly effective, direct feedback. You interrupt a behavior that you think is problematic or unacceptable for some reason, usually because it's unsafe or disrespectful. And they have an option right then and there to try something different. Much more impactful than them reporting into you next week that they did something and they got in trouble for it. Now we're going to reflect upon it, that sort of thing. So finally, in talk therapy, we hope that they learn through the insight of our conversations. And in adventure therapy, they learn by doing, through action. I'm pretty sure I'm out of time. And I could talk about this for, a few more hours, but I'm going to stop sharing now and turn it back over to the Echo people.